My name is Jocelyn Villarreal. I am an advanced health assessment student, and today we will be doing a neurological examination. The patient is a 24-year-old Hispanic male presenting to the clinic for a wellness checkup. He is alert and oriented ×3 without any signs of distress. Affect, behavior, speech, and communication are appropriate. Public health questionnaire 9 is a score of 1, and his vital signs have been collected and are as follows. Blood pressure 121/82, respiratory rate 15, heart rate 78, temperature 98.5, and he's sitting at 100% on room air. So my hands are washed and I've introduced myself to the patient. So first and foremost, I would like to obtain the consent of our patient to get a video recording of today's assessment. Is that okay with you?
Yes.
Okay, thank you. So let's proceed with our examination of the cranial nerve. Starting off with cranial nerve number 1, I'm going to be checking for the patency by having you cover one nostril and taking a breath in and out. And then again. Very good, thank you. And then I'm going to have the patient identify 2 smells. So for this, I need you to cover your eyes and occlude again one of the nostrils and let me know if you can identify the smell.
Yes.
What is it?
That's cumin.
Okay, and then I'm going to have you do the same by occluding your, again, occlude your opposite nostril. What is it?
That's cinnamon.
Very good. So that was to test for cranial nerve number 1. Next, I want to test for cranial nerve number 2, the optic nerve. And for this, we're going to be checking the patient's visual acuity. And for this, I'm going to have you cover, let's start off with your left eye. So cover your left and read to me the smallest line that you can visualize on this chart.
LTFPH.
Very good. And again, cover your right eye this time.
LTFPH.
Very good. So the patient has a 20/20 best corrected vision reading off of the Rosenbaum chart here. I'll be checking for your peripheral vision next with your visual field. So just let me know when you are able to identify my fingers at your sides, okay?
No. No. No.
Okay, very good. So the patient's visual field is intact, and I'll proceed by now doing your direct ophthalmoscope exam. For this, I'm going to ask you to remove your glasses and ideally have the room lit darker. And I'm going to identify the red light reflex. Starting with your right eye, just go ahead and look towards me. Right, so the patient's optic discs have sharp margins on both the left and the right eye. The retinal background is even in color without any exudates or hemorrhage, again in both the left and the right eye. So again, testing for cranial nerve number 2 and cranial nerve number 3, the oculomotor, we're going to be doing a pupillary eye exam. Alright, so for this I'm going to have you focus on an object across the room while I shine the light into each eye. Thank you. So the pupils are equal in size and they constrict briskly to about 2 milliliters with direct and consensual reaction to light. So an appropriate pupillary response reflects an integrity of the optic nerve or cranial nerve number 2, and it also reflects the integrity of cranial nerves number 3, number 4, and number 6. Next, to check for near reaction, I'm going to have you focus on an object again across the room and then focus your eyesight back to my pen. Back to the distant object and then back to the pen. Very good. Now checking your extraocular eye muscles, which is cranial nerves number 3, number 4, and number 6, I'm going to have you, with your head still, only follow my finger with your eyes. Ready? Okay, so we can see that these cranial nerves are intact. Next, I'll have you follow my finger to your nose, again with just your eye. Okay. So we can also see again that the extraocular movements are intact without any nystagmus or strabismus noted. Next, to test for cranial nerve number 5, the trigeminal or motor nerve, I'm going to ask you to clench your teeth while I feel over the muscle. Here, starting in the temporal muscle, clench your teeth, and then the masseter muscle. Very good. So I can see that this cranial nerve is intact and the facial movement is symmetric without any involuntary tremor. Moving on to the sensory portion of the cranial nerve number 5, I'm going to have you identify a soft versus a sharp sensation. So for example, this is soft and this is sharp.
Yes.
Okay? I'm going to have you close your eyes for this.
Okay. Soft. Soft. Sharp. Soft. Soft. Soft.
Okay, so we can see that the sensory portion of cranial nerve number 5 is intact. Now moving on to the corneal reflex with a cotton wisp. I'm going to test for your corneal reflex. Coming in laterally, just open your eyes. Very good. And I can see that the corneal reflex is intact. Okay, so now testing for cranial nerve number 7, I'm going to have you do a series of facial movements. So for this, starting off, I want you to raise your eyebrows. Very good. Frown. Shut your eyes tightly, and here I'm trying to open the eyes and I cannot, so that's good. Puff your cheeks, show your teeth, and now go ahead and smile. Okay, very good. So here I'm assessing for any unusual or asymmetric facial movements, which would be indicative of muscle weakness. Now for cranial nerve number 8, the acoustic nerve, I'm going to have you occlude one ear, and I'm going to whisper some words or numbers. I'm going to whisper numbers into your opposite ear and let me know if you're able to, or repeat back what you heard.
6, 3, 9.
Very good. And now I'm going to have you occlude your left.
7, 5, 3.
Very good. Next, for cranial nerves number 9 and number 10, here I'm listening for speech sounds or any difficulty in swallowing. Also, I'm going to have you go ahead and open your mouth, and I'm going to have you say ah. Say ah.
Ah.
So by having the patient say ah, I'm testing for the motor function of cranial nerves 9 and 10. And I can see that the uvula is midline and the soft palate rises. If we don't see the soft palate rise, or if we see a deviation in the uvula, then that would indicate nerve damage to these cranial nerves number 9 and number 10. And then again, for the same cranial nerves, I'm checking for the gag reflex. So I'm going to softly touch the back of the throat. Okay. Now checking for the gag reflex, I'll be lightly touching the back of the throat. And again, this is for the same cranial nerves 9 and 10. There is upward movement of the soft palate here, and the gag reflex is intact. Moving on to cranial nerve number 10, number 11, the spinal accessory nerve. I'm going to put my hands on the shoulder and I want you to shrug against my resistance. Okay, very good. And then I'm gonna have you turn your neck towards your left or against my hand. Very good. And again. So I can see that cranial nerve number 11 is intact. And lastly, to check for cranial nerve number 12, the hypoglossal, I'm going to inspect the tongue at rest in the mouth. So go ahead and open your mouth. And then again, while you protrude your tongue, and can you please move it side to side, and then curled up, curled down, very good. And then I'm going to have you push against my hand with your tongue in your mouth. Very good. Thank you. So with that, that concludes our cranial nerve examination, and we can move on to our examination of your coordination. So moving on to coordination of the upper extremities, I'm going to have you pat your thighs or knees and rotate your palms upward by increasing your speed. Okay, perfect. Now the finger to nose test, I'm going to have you follow my finger back to your nose and so on. Perfect. Now moving on to the lower extremities, go run your heel straight down your opposite shin. Very good. And now we're going to watch you take a few steps. And go ahead. Okay, come the other way, please. And I can see a coordinated movement with an upright posture. And now I'm going to have you walk heel to toe in a straight line. And back over here. Very good. We could see uncoordinated movement, for example, in cerebellar disease, and tandem walking may reveal like any distal leg weakness. So next I'm going to have you take a few steps on your toes and then back on your heels. Go ahead. And then lastly, I'm going to have you hop in place on one foot and then the other for just a few seconds. And then your other leg. Thank you. Alright, next to test for Romberg and pronator drift, I'm going to have you stand together with your feet together. Close your eyes and keep your eyes closed for a couple of seconds. Perfect. So the patient has remains in an upright posture. I don't see any swaying. And then to check for pronator drift, I'm going to have you do the same. But bring both of your arms out for about 30 seconds or so while I gently tap down on your shoulders or arms. Thank you. If we were to have seen any loss of balance during the pronator drift exam, again, this would be something indicative of cerebellar dysfunction or any kind of sensory loss. Now moving on to our assessment for the patient's motor system. Here we can see that he's in a neutral position at rest, and I'm not seeing any involuntary movements. So now I'm going to ask you to hold your arms out for a couple of seconds. Just in front of you. And again, I'm not noticing any tremors or tics or fasciculations. So I'll ask you to bring your gown down a bit just to assess for the muscles in the upper extremities here. And then again, lift your gown so I can assess the muscles in the lower extremities. And we can see that the muscles in the upper and lower extremities are symmetric and similar in shape and mass without any signs of atrophy. To assess for muscle tone and resistance to passive stretching, I'm going to be assessing here the upper extremities. Okay, and I'm going to be doing having you flex your elbows with your hands or thumbs facing towards you, and I'm going to apply resistance while you're trying to flex and extend. So go ahead and flex your elbows here, and then try to extend them, and let's do the same for your wrists. Okay, and now I'm going to have you adduct your fingers, and again I'm going to apply pressure while you're trying to extend them out or adduct them out, and then bring them close together. Bring them close. Okay, and then lastly, I'm going to have you place your thumb to the tip of your finger, and I'm going to be checking again. And here we would see a decrease in that particular muscle tone in patients with carpal tunnel syndrome. So then to test for grip strength, I'm going to have you close your hands around my fingers, and I'm going to try to withdraw. Okay, so we can see that the muscle tone and strength in the upper extremities are 5 out of 5, which means active against all of resistance. So now moving on to the lower extremities, starting off with your hips, I'm going to have you push up against resistance and then push down. Okay, and then down. Okay, and then I'm going to have you bring your hips apart, so adduct, and then again bring them towards the midline against resistance. And then in. Very good. And next, your knees, I'm going to have you flex and extend the knee against resistance again. And lastly, for the feet, I'm going to have you press down like you're pressing a gas pedal, and then upward. And then the same with your other foot. Down, and then up. Thank you. So again, the lower extremities strength is a 5 out of 5, meets against all active resistance. Now to test for the sensory system, again, I'm going to be applying a sharp sensation and a soft sensation. So this is what sharp feels like, and then this is what soft feels like. So I'll be doing this throughout the body, and let me know what you're feeling. So close your eyes for this, and let's begin.
Sharp. Sharp. Soft. 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 Sharp. 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 Soft. 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 Sharp. Sharp.
Let me do the fingers.
Sharp. Soft. Soft. Sharp. 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 Soft. Soft.
So we can see that pain and light sensation are intact bilaterally in the upper and the lower extremities. If the patient were not able to identify some of these sensations, then we can do test for the sensation of temperature with warm and cold water-filled test tubes. Okay, next, testing for proprioception. I'm going to wiggle the toe, and you're going to let me know what position I've left the toe at. Okay, what position is a toe in?
Up.
Okay, and then also doing the left foot, keeping your eyes closed. Let me know what position the toe is in. Okay?
Down.
Very good. Next, testing for the vibratory sense. I'm going to strike a tuning fork over the distal interpharyngeal joints of the fingers and of the great toe, and I'm going to ask you to let me know when you feel the vibration stop. Okay, let me see. Turn your hands over. Now we're going to do the same, but on your left hand. Okay, very good. I'm going to do the same, but now on the toes. Let me know when you feel the vibration stop.
Stop.
Okay, and then I'm going to do the same on your left. Tell me when you feel it stop.
Stop.
Alright, so here we are looking to see if the vibratory sense is intact. So this sense may be impaired in alcoholic peripheral neuropathy. Now let's move on to the discriminative sensations, starting off with sterignosis. And for this, I'm going to have you identify an object placed in your hand. Close your eyes and let me know what object you feel, starting off with your left. Close your hand. What do you feel?
Feels like a coin.
Is it a small coin or a large coin?
Small.
Okay, can we have it back? And now let's do your right hand. Keeping your eyes closed. What does that feel like?
It feels like a quarter.
So a bigger coin?
Yeah.
Okay, very good. So here we are testing again for sterignosis, and the patient is able to identify the object. Now I'm going to be checking for something called graphesthesia, and this I'm going to outline a number or a letter and let me know what is it you feel.
8.
Very good. Let me do your other hand.
A.
Okay, perfect. So again, this is graphesthesia, and we can see that it is intact. All right, and now to test for 2-point discrimination, let me know if you feel 1 poke or 2.
2.
Keeping your eyes closed.
2. Just 1. Just 1. 2. 2.
Okay, so again, this is 2-point discrimination, and we can see that it's intact. Now, moving on to point localization, I'm going to touch an area of the body, and then you're going to open your eyes and let me know where it is you felt the touch. Ready?
And my chest.
So localize where you felt the sensation.
Right here.
Okay. Again, keeping your eyes closed.
On my right leg.
Localize it, please. Again, close your eyes.
Right
And keep your eyes closed.
here. Right
Okay, perfect. Thank you. Now let's move on to the deep tendon reflexes of the upper extremities, starting off with the biceps tendon here. Keep your arm as relaxed as you can. Okay, and then I'm going to do the tricep above the elbow here. And then the brachioradialis, about 2 inches above the wrist. Perfect. And now doing the same on your left side. Keep your arm as relaxed as you can. Now let's do the lower extremities. So I'm going to do the patellar tendon here, and the left here, and then the Achilles tendon. I'm going to have you relax the foot. Test for cutaneous stimulation, starting off with the abdominal muscles. I'm going to briskly form an X towards the umbilicus, and here we should just see slight muscle contraction of the abdominal wall. Now to test for the cutaneous stimulation reflexes on both of the plantar surfaces, I'm going to stroke upward, and let's start. It may be slightly uncomfortable, okay? Okay, and this is what we want to see. We want to see the downward flexion of the toes. So that's our right, and let's do our left. Okay, and very good. So any upward flexion, or like our Babinski's reflex here, would be indicative of a corticospinal tract lesion. So that's what this would be for. So next, to test for the meningeal sign, starting off with our Brudzinski sign, I'm going to flex the neck or the chin towards the chest a few times here. And here we are looking for any hip or knee flexion, which would be indicative of a positive Brudzinski's test. Okay, now doing our Koenig sign, I'm going to flex the leg at the knee and the hip, and then straighten out the leg on each side, and we're looking for any increase in resistance.
No.
Perfect. And lastly, for our straight leg test, and again for this test, any radicular pain is indicative of a positive test. And with that, that concludes our assessment for today.